Welcome everyone, how are we doing? Thank you. I hope this is mine, whoever gave it there, I'm taking it. Today is Thursday, yeah? Today's Thursday, that means we're doing lower body mobility. We're gonna focus on the foot, the ankle, the knees, hips, pelvis, and the whole rest of the spine in relationship to the lower body. We'll start with breathing. We're gonna start with laying on the ball below the belly button, laying on the ball below the belly button. What I'm looking for when you breathe is that you move. You move the ball when you breathe. If you lay on the ball, see my lower back move. Most of the time when people breathe and when the ball's there, they don't breathe into the ball, they'll breathe in their chest. That means I won't see your back move. If I don't see your back move, it's small enough, I'll come around and tap you on the back. My expectation is that you take a big breath into the low belly, then you exhale 5, 4, 3, 2, 1. Hold your breath out, 5, 4, 3, 2, 1. Then you take a big breath in, fill up the ball, push the ball out, then exhale, let the ball sink in towards the front of your spine. Let's go for 90 seconds of breathing. Lay down on your front. There we go. There we go. Lay down on your front. Turn your head to the side. That's it. Rest your shoulders and arms down by the side of you. Like I said, my own expectation is that I see some movement around your lower back, please. Some movement where the ball is. Yeah, there we go. Big breath into the lower back, into the ball. Exhale, 5, 4, 3, 2, 1. Hold your breath out, 5, 4, 3, 2, 1. 30 seconds. Rest. Nice. Ball's gonna move up to zone 2. Same principle of breathing. Nice work, everyone. Same principle of breathing. Big breath in, push the ball out. Because the ball won't go anywhere, your back will move. That's what I'm looking for. Big breath in, let the lumbar spine move. Exhale. Try and imagine the ball touching the front of your spine. If you exhale enough, it'll be about 2 centimeters away from the front of your spine. Fully relax and let the ball go all the way in. 90 seconds of breathing. Let's go round 2. Grab a ball, bro, as quick as you can. Round 2, let's go. Yelp. It's common. It shouldn't. It's not normal, but it's common. The muscles or the organs. Yeah. That's why we're doing this, so that it removes the pain. If you need to, yeah. If you need to, I would try and massage your face so you get some space. Yeah, but even if you inhale nose, exhale mouth. Yeah. Right above the belly bone. Right in this area. Breathe into the ball, exhale, let the ball sink in. Turn your head to the side, that's it, rest. Yeah, have your head resting down on the ground, down by the floor. Then do your best to regulate your breath and your timing. Breathing in. Exhaling. 5, 4, 3, 2, 1. Seconds. Try to keep the pelvis heavy, try to keep the hips heavy. Beautiful. Rest, 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 rest. I had a question when some of you started, is it normal that the belly hurts? I wouldn't say it's normal, but I say it's super common. And most people have discomfort here. We shouldn't really have much discomfort here. If you have discomfort, it's more likely you have super tight abs, like super tight abs, and they're not stretching, and or you have organs that don't move very well. Your organs are like joints, they articulate. Your organs move like a joint. If you've got pain, especially deep, like who felt their heartbeat when they were laying on that's like tight muscles around your aorta. I would definitely be doing that until that shit at least feels more relaxed and easier. Because that's one of the biggest valves that come out of your heart and feeds most of your organs, or most of your limbs and organs. So if you're feeling a lot of discomfort around there, I would say 5 times a day for 3 minutes, and tell me how it feels in about a week. It should feel way better. Today is lower body. We're gonna do a lot of hip rotation today. I need it. I need hip internal rotation. So what we're gonna do is we're gonna start in this 90-90 position. That's it. And what I want you to do is observe a couple of things. First observation is, are both my sit bones touching the ground? Do I have both halves of my pelvis sitting on the ground, or am I up on one side? It's the first observation. If you're up on one side, that means that your pelvis is more likely lifted and you have some sort of compensation in the spine instead of having hip internal rotation. So first observation. The second observation is, how easy is it to move from side to side without moving my head? So when you're ready, move to the other side. Good. And when you sit on your other side, because you probably picked your better side first, pay attention. Is this side up or is it down? Do I feel discomfort in my knees? Is my back straight? Second observation is, how easy is it to switch? So switch, try it out, change sides. Yeah, and it's not that, it's not that, it's, I'll show you again. We're gonna spend 1 minute switching. Watch me again, both sides, watch me again, both sides. My first observation on my sit bones. My second observation is, how easy is it to come out of internal rotation? How easy is it to balance? Normally internal rotation is okay, normally. And then, external rotation. And then how much difficulty do I have when I'm trying to go to internal rotation on the other side? Switch again. So we come out, one at a time. Yeah, exactly as I showed. Yep, good. Now, we're gonna spend 1 minute switching. What you can do to stop your head moving is block. Hands can go anywhere, but you can put your hand down. When you feel that you've got balance, you can balance. I know that I'm gonna cheat, so I'm gonna put my hand down and keep stability and force my hip to rotate. Then when I get there, I'll take one breath, then I'll switch. Let's go, 1 minute. Good. Cramp's a good sign. Cramp means that you're working a muscle. And we're not doing that. Yeah, we're doing it exactly as I showed. So I find coming out of internal rotation okay, balancing okay, external rotation, but going in is where, so one at a time, one at a time. Look, I'll take one leg, I'll then balance, I'll take the other leg in, and then when my head or body move, I put my hands down to stop it. Yeah, I don't want any movement through your spine to do what your hip should be doing. Yeah, and it's okay because unless we actively work internal rotation, which most of us don't even get taught, let alone train, it's really, really hard to move between those. So keep going a little bit longer. Try to maintain control. Good. We're now going to do the active component. I find that when the body moves a little faster, when I add a bit of blood flow in there, things will move a bit better. Plus, I'm going to allow you to move. So watch. I'm going to, when I get here, I want to go 1, 2 as quick as I can. Then I'm going to balance, 1, 2, back. You can use your hand, but I'm not going slow. I want to go as quick as I can and back, and then I transition slow. When I'm ready, let's go. 1 minute. 1 minute. This is called kick the door. Think about this. This is called kick the door. Kick the door, come back. Change. That's it. There and back, good. And then slow to transition to the other side. Good. 30 seconds. Good. Nice. Good. Try and balance without the hands, yeah. And then if you need them, watch your foot. Good. Good. Nice. Rest on one side. Rest on one side. In fact, stand up. First thing I like to do is check things out after I do a little bit of work. That will be done through a squat. That will be done through a lunge. And a lunge. And that will be done through some sort of balance leg and some sort of kick leg. And then I switch. I will balance and I'll kick. We didn't do a one side, so this shouldn't feel too different, but I definitely feel a bit better in my squat on both legs. You may or may not observe anything now, but every time we do something, we're gonna check in and make sure that you at least don't have pain. So let's go back down. Pick a side now. Pick a side. First thing I'm gonna do is spend 1 minute in my lower body, minimizing movement here. Yep. We get extra reps here. So what I'm gonna do, I'm gonna let my hands move a little bit. I'm gonna fidget side to side. I'm gonna move my leg. I'm gonna move my leg. I'm gonna move my leg. And as I move my orientation, look how different this leg can be to here. It's a 90-degree difference. Same here, look. I can be here, or I can be here. That is a very different stretch in my tissue. So you're gonna spend 1 minute. Let's go. 1 minute moving here, 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 here. I know, but we're moving as much as we can because the position you land in isn't always the right position. Move my leg open, move my knee open, move my knee to 90 degrees, front knee closed, front knee open, back knee closed, back knee open to the side, to the front, 45, 90. Good, we're almost done in a minute here. We're almost done in the minute of moving our lower body. Now, find your most comfortable place after that minute. What I've realized is that I'm more comfortable on my foot versus on the side of my foot. That's what I'm sitting more comfortable this way. That gets both my sit bones down. Now we're gonna spend 1 minute moving below the belly button. Yeah, and what I'm seeing with a few of you is extra movement. We wanna send, yeah. So what I like to do when we're struggling to make circles is I will tuck under, untuck, tuck under, untuck, tuck under, untuck. Good. Then I'll go, which is harder without moving my shoulders, I'll lift the hip, try and lift the hip, lift the hip, lift the hip, lift the hip, lift the hip. Then I'll turn that into a circle one way and turn that into a circle the other way. We're trying to create as much lower spine movement as we can. Good. Now we're going to do the same in the upper part of the spine. I'm going to flex. I'm going to extend. I'm going to side bend. I'm going to side bend. I'm going to rotate. I'm going to rotate. We're going to do a lot of that. Flexion. As I move my head and my rib cage, what I'm not doing, watch. I'm not letting that butt move. I am only moving in the spine versus moving my hip with that. That's what I'm trying to do, is create difference in my movement. Flexion, extension, side bend, rotate, rotate. We probably got, we got time for one more. Flexion, extension, side bend, rotate, rotate. Let's stand up. Take your legs up. Take yourself off the mat, actually. find the ground will give you a better feedback. Let's squat. Let's lunge. Lunge. Balance and kick. I'm very clearly different in my hips. This hip socket that was in internal rotation is a lot smoother. I have a better contact. This one's not bad, but I have better contact with the ground. This kicks easier. And this is balanced better. I'm hoping you notice a difference. I'm hoping that your difference is positive. If you don't notice the difference, you're not paying attention. And it's okay because we have another half. I need you to pay attention about how does it feel. And now we're going to go back into the other side. So let's take a seat. One minute. We're going to do switch. We're going to switch 1 minute. Yeah. We're going to switch 1 minute like we did at the beginning. Remember, you can use your hands. You don't need to. Like, I can come out of it and I can now when I go to this side, it's easy. Easy to go in and out of internal rotation. That was the leg I just did. But when I go to my other side, you can see that it's harder for me to get there. Let's go 1 minute. Switch, and when you need to, use your hands. That's not what we're doing. We're not going like that. It's not what we're doing. Yeah, we're doing a very specific movement. I'm asking you to bring one leg out of rotation, then leave it there balanced. I'm then asking you to bring the other leg out of rotation and be balanced. That's a position. Yeah. Then I'm going to ask you to bring your leg into external rotation, then your other leg into internal rotation. We do that observing how much we move our upper body. Because when I do this, I can do this all day and not have much change to anything except just getting better at that pattern. From here, switch side to side. You got 5 seconds. Land. Good. Land on your other side. We're going to do kick the door for 1 minute. Remember, kick the door. Get ready. Head can come forwards, no problem. But the objective is back forwards. Slow, slow. Let's go. Very nice. "20 seconds, keep going. Good, land on your other side now. Now we're on our other half. We're going to do what we did last time. We're going to spend 1 minute fidgeting. Always where I land isn't always the right place. I'll move my butt. I'll open. I'll open. I'll open. Close. 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 Open. Close. Spend the next 30 seconds giving me every possibility in your lower body, every combination of angles in the knee in relationship to the hips. Open, closed, open, open, closed, open, 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 closed. And as I'm doing this, I've already found a way better setup than I started with, and that's a minute. So, we should be on the other leg, yeah? We should be on the other side. We should be in a different position to what we landed. Now, we're gonna spend 1 minute here. So I'm gonna tuck under. I'm gonna laterally shift. And as I do that, I'm doing my best to keep this shit quiet, kind of. Rather than this, it's this and this. Try and make a circle. Change that circle direction. Ten seconds. Nice. 1 minute. Flexion. Extension. Side bend. Side bend. Rotation. Rotation. Flexion. Extension. Lateral flexion. Lateral flexion. Rotation. Rotation. Couple more. Flex the spine. Extend the spine. Side bend side to side. Rotate and twist. Side to side. One more time. Flexion, extension. Side bend. Side bend. Rotate. Rotate. That was everything, yeah? Stand up. Stand up. Squat. Lunge. Lunge. Balance and kick. My hips feel a bit more awake, I can tell you that for sure. Come over this way. We're going to do more hip rotation now. We're going to do more hip rotation. Good, make sure you can see me. We're gonna do a thing called a hip cart. I pretty much teach this to every single person. Every person that comes and finds me, I do an assessment with them. My assessment is how do you control the rotation of your hip? Most people, when they go to control the rotation of this hip, they will move their spine, they will move their standing leg, they will move the pelvis, the back and the neck, take their back into extension, and then finish their exercise kind of where they started. Then they do the same thing in reverse. They'll extend along the spine rather than taking the hip into extension. They will rotate their standing leg. They will move their lower back and their pelvis, and then they come back to what you would call neutral, and then they drop it down. So this is a block. This should give you feedback. What I'm going to do, what I'm going to ask you to do is take your inside arm either here or here. Yeah, whichever's comfortable in the shoulder. My outside arm will come across, and this will give me feedback. This will give me feedback, and I have to pay attention to the rest of my body. So I'm going to bring my hip up into flexion. I'm going to open my leg. When I open my leg, I'm being aware that I don't want this leg to do the rotation. I want this leg. I want to take my hip into rotation rather than my pelvis shifting. From here, I'm going to then attempt to stabilize, bringing my leg back. And then I'll finish my circle here. That's half a circle. That should take 30 seconds, give or take. I'm then going to go back. I'm then going to open. I'm going to try and lift my shin together, up, 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 without changing my shoulders, without changing my head. I'm probably going to get cramp. I'll take it to kind of the front somewhere and I'll drop it down. That will take another 30 seconds. Per whole circle, it should take 1 minute. We're going to do 3 circles. Imagine I'm coming back on my 3rd circle. On your 3rd pass on the way back, somewhere here is the shittiest for most people I work with, this rotation. So what I'm going to ask you to do is spend an extra 30 seconds circling, circling, zigzagging, and I'm doing that, trying to keep control rather than getting tired and allowing my body to break down. If I get tired, I'll take the leg closer to the ground, but I'll still try and control the movement. I'll say, get ready, 3, 2, 1. You'll just bring your leg back, and then you'll finish like a circle. I think we're going to be good for here. Don't need to take too much room. Move the equipment out of the way if we can. Okay. So, I'm not gonna hold on. I'm not gonna hold on. So I might move a little bit. I don't expect you to move. That's it. Outside arm, inside arm up or down. Outside arm, cross, yeah. This is gonna give you feedback. That one, yeah, there you go. Grab hold of the bar. Grab the bar, yeah, there you go. And that will just, you'll feel if you move then. Yeah, we want to try to keep this quiet. We're trying to move our hip the most. So when you're ready, make sure you're stable and then slowly bring your knee up. Open your knee out to the side and then rotate at the hip. And then from that rotation, I'm going to send my knee behind me, keeping my standing leg connected. Yep, keeping my standing leg connected. That's it. Yeah, all the way until I finish my circle. Good. I'm going to reverse. I'm going to go back. I'm going to open my hip. Good. I'm going to lift my knee and my ankle. And I'm going to go slow. I'm going to keep my shoulders balanced. I'm going to keep my head balanced. My eyes on the horizon. And then I'm going to take my leg down. That's 1. Go for number 2, I'll lift my knee. I'll open out to the side. I'm going to rotate at the hip. Be careful and be aware. We don't want our shoulders to move. We don't want our eye level to move. We'll take that all the way back. Eye level. Yeah, there you go, all the way. And then I'll finish that circle, good. Reverse, I go back. I open, pelvis stable. Lift the knee, lift the ankle, and the shoulders, all the way around and through. Go slow, make sure you have a big hip flexion. Take the leg down. 2, last set. Bring the knee up. Closer. Yep, there you go. Open. Rotate. Good. Go slow. Do your best to not move your spine, your standing leg, your shoulders, or your head. Nice. Reverse. Get ready to hold. Open. Lift. And then somewhere here for me is where it cramps, where I'm very, very tired. So I'm going to go in a circle one way. I'm going to keep my head and my shoulders stable. So even if my leg is tired, I'm not going to let it move my head. That's it. I'm going to go one way. I'm going to go the other way. I'm going to slow my breathing down. I'm going to focus on my exhale if I get tired, because the exhalation will remove extra carbon dioxide and should recover you faster. Good. Let's say that's about 30 seconds. I'll bring the knee up, and then I'll take the leg down. Good. Rest. Hip circles. Squat. Lunge. Lunge. Kick in 3 directions. Kick in 3 directions. Yeah, I feel difference in these, even though my leg's tired. Whose standing leg got tired? Yeah. Standing leg getting tired means that you want to compensate a lot in your movement. When it's blocked, it's forced to act like a stabilizer. Good job. When you do this, even if you're tired or sore, you need to down-regulate your intensity. Even if we're going to go here, if this looks like that, your nervous system's going to react like that. So if that's too much, that's okay. That's okay. That's okay, but that's not okay. Make sure it's, even if it's difficult, make sure it's good. Because if you tell your nervous system, it's going to keep repeating those loops. You're going to keep experiencing the pain. So make sure everything is in a more comfortable position. Even, so we know our other side, switch sides. Second side is going to be your more difficult side. Yeah, second side is going to be your more difficult side. Yeah, switch with a partner. There you go, yeah. And make sure, as hard as this is, make sure you go easy on yourself. We have 3 minutes of work. Make sure it feels nice, you can breathe, and you feel comfortable through these movements. Let's prepare ourselves. We grab, or am I on this hip? I'll be here. Here we go. I'm going to lift my knee. I'm going to open. I'm going to rotate. And I'm slowly thinking about my shoulders, thinking about my head, thinking about my hip. My movement, good. I'm going to extend. I'm going to rotate. And I'm going to send my legs slowly, trying not to move my pelvis, my standing leg, keeping in control of everything, shoulders relaxed, head relaxed. That's one, really good. Bring the leg up, open, rotate. As you rotate, begin to extend the hip. Send the leg all the way round, all the way behind, and together. Great. Reverse. Rotate. Lift the knee, lift the ankle together. Try not to move the spine. Don't let the shoulders change level. Don't let the eye level change. And come down. That's number 2. Very good. Very good. Last set. Best set. Lift the knee. Open. Rotate. Go real slow with control. Pay attention to where you want to cheat, where you want to compensate, where it hurts, where it might click, and try and stay in control. Reverse. Open. Lift. And somewhere here I'm going to start to make a circle. Change that circle direction. I'm going to regulate my breathing. If it's difficult, I'm going to take my leg lower so I can continue the movement without going beyond my control and resting. I want to be able to maintain control for another 5 seconds. I'm going to bring my knee up and in. I'm going to take my leg down. Jump, jump. Your legs up. Squat. Lunge. Lunge. 3-direction kick. 3-direction kick. Let's go. Let's stay here actually. We got enough room. I'm going to use that. Guys, come over this way. Have a little look at me. I'm going to use that one. Yeah, it's okay. Make sure you can see me. We sometimes do this on the wall where I get to hold. What you're going to do is you're going to pick your leg up. Most of the time when people pick their leg up, they stop in a chair. We have a lot more hip flexion. So I'm going to ask you to take your leg into hip flexion, the highest you can actively move your leg. Then I'm going to say move it more. There's probably going to be a bit more. You're going to observe this angle. Then I'm going to ask you to grab hold of your leg and bring it in. That difference, that is where you're going to get injured. We go to the mats. You have strength control here, but if I push your knees to your chest, you don't have that control. So what you're going to do is you're going to take the slack up. You're going to measure the new distance. We're going to hold that for about 15 seconds. I'm going to say 3, 2, 1, let go. My leg wants to go down. I'm dying right now, but 3, 2, 1, grab hold. 15 seconds, you saw my leg lower and I was doing my best to hold it up there. 15 seconds, round 2, get ready. 3, 2, 1, let go. Three, 2, 1, grab hold. Third set after 15 seconds hold. Third set. 3, 2, 1, go. Control your exhalation. 3, 2, 1, 5 seconds, and slowly, slowly, slowly down. Release, squat, lunge, lunge. We'll do the same on the other side. Let's go. Okay. Ready? Don't hold your leg yet. No, I know, me too, don't worry. Bring your leg up. Look where it is. Don't hold it yet. Look where it is and lift it higher. Already you can go higher. Lift it higher again. Make sure that this hasn't changed. One more time, lift it. Good. Now grab hold. And make sure that we don't lean back. Stay balanced. Good. We're doing a 15-second hold, but stretch. Get ready. Static. It's a static hold for 15 seconds. Get ready. 3, 2, 1, let go. Drive the knee as high as you can. Don't let the head move. Don't let the hip go move. 5 seconds. 3, 2, 1, grab holds. Good, 15 seconds. Get ready, 3, 2, 1, let go. I'm gonna hold on my next one. Keep driving that knee high. Don't let that knee drop. 5 seconds. 3, 2, 1, grab hold. Last set, get ready. Last set, get ready. A little bit of balance is gonna help. Get ready. 3, 2, 1, let go. Drive the knee as high as you can. Keep your standing legs straight. Keep your shoulders over your hips. Don't let your lower back curve. Keep your eyes on the horizon. 5 seconds. Drive the knee, drive the knee. 3, 2, 1, grab holds. And slowly down, slowly down, slowly down. Release. I don't need you dying in my class. I don't need you dying in my class. Squat, lunge, lunge. Good. Balance and kick. Balance, kick. Let's change sides. We ready? Okay. First one is active. Don't hold on. Let's go lift the knee up. Look where it is. Lift it higher. Already that's higher. Good. So when I first asked you to lift your leg as high as you could, you stopped yourself. Lift it higher again. There you go. Make sure your body's connected. Yep. Then, when you're ready, look at where your knee is and grab hold and go, oh shit, it moved a bit more. That's okay. You're gonna learn to close that gap. You're gonna get stronger right now. Get ready. 5 seconds. 3, 2, 1, let go and hold the leg where it is. Keep the standing leg straight. Keep good posture in your body. Maintain control of your breath. 5 seconds. 3, 2, 1, grab holds. Good job. Use this as a quick recovery. 3, 2, 1, let go. Drive the knee. Standing legs straight and strong. Posture long. Back of the neck long, not chin lifted. 5 seconds. 3, 2, 1, grab holds. Last set, best set. Last set, best set. 5 seconds, get ready. 3, 2, 1, let go. Stay strong. Drive the knee. Standing leg straight. 5, 3, 2, 1, grab hold. And slowly, slowly, slowly. Fucking 3 sets is crazy hard, huh? When you're ready, squat. Lunge. Good lunge. I could see with a few of you, you fell into that squat way faster. Nice. Let's go back. Let's go back.